If you're over 60 and you've noticed that things down there aren't quite what they used to be, you're not losing your mind, and you're definitely not alone. What I'm about to tell you might shock you. The average man loses about half an inch of penile length between ages 60 and 70. But here's what the doctors won't tell you in your 5-minute appointment. Most of this is preventable, and some of it is even reversible. Stay with me for the next 10 minutes because I'm going to break down exactly why this happens, the one factor that accelerates it that 90% of men don't know about, and the specific steps you can take starting today to stop, and in some cases reverse, this process. Let's start with the uncomfortable truth. As men age, penile size does decrease. We're talking about both length and girth here. The research shows that men typically lose about 1 to 2 centimeters in length and some circumference between their 40s and 70s. That's roughly half an inch to 3/4 of an inch for those of us still thinking in imperial measurements. Now, before you panic, understand that this isn't some rapid, dramatic change that happens overnight. This is a gradual process that occurs over decades, and most men don't even notice it happening until they're well into their 60s or 70s. But here's what's really important to understand. This isn't just about vanity or ego. These changes are actually indicators of your overall vascular and hormonal health. The same processes that affect penile size are also affecting your heart, your brain, your energy levels, and your overall vitality. So when we talk about addressing penile shrinkage, we're really talking about addressing your overall health as a man aging gracefully. The medical term for this is penile involution, and it's as natural as getting gray hair or needing reading glasses. But unlike those changes, this one can often be slowed, stopped, or even partially reversed with the right approach. So why does this happen? There are 4 main culprits, and understanding them is key to fighting back. First, there's what's called collagen accumulation. As you age, your body produces more collagen in the penile tissues, but not the good kind that keeps your skin young. This is tough, fibrous collagen that essentially creates scar tissue within the penis. This scar tissue is less elastic than healthy tissue, leading to both length and girth reduction. Second, we have reduced blood flow. Your penis is essentially a vascular organ. It's all about blood flow. As you age, the small arteries that supply blood to the penis become narrower due to atherosclerosis, the same process that affects your heart arteries. Less blood flow means less engorgement, which over time leads to tissue changes and shrinkage. Third, there's the testosterone factor. After age 30, testosterone levels decline by about 1% per year. By the time you're 60, you might have 30% less testosterone than you did in your prime. Testosterone is crucial for maintaining penile tissue health, and low T accelerates all the other processes I'm describing. Fourth, and this is the big one that most men don't know about, lack of regular erections. Here's the thing. Your penis needs regular blood flow to stay healthy. Men who don't have regular erections, whether from erectile dysfunction, lack of sexual activity, or certain medications, experience faster tissue deterioration. It's literally a use it or lose it situation. There's also a fifth factor that accelerates everything: chronic inflammation from poor diet, lack of exercise, smoking, and excessive alcohol consumption. This systemic inflammation speeds up all the aging processes I've mentioned. Now let's address the elephant in the room: how this affects you mentally and emotionally. For many men, discovering these changes can be devastating. You might feel less masculine, worry about your partner's satisfaction, or avoid intimacy altogether. These feelings are completely normal and valid. But here's what I want you to understand. Your worth as a man and as a partner isn't measured in centimeters. However, I also understand that this matters to you. It would matter to me too. The good news is that there are proven ways to address both the physical changes and the psychological impact. Many men report that taking action, even small steps, to address this issue significantly improves their confidence and overall well-being, regardless of the physical results. Sometimes just knowing you're doing something positive is half the battle. All right, now for the part you've been waiting for. What can you actually do about this? Let's start with the fundamentals that every man over 60 should be doing. Cardiovascular health is penis health. Everything that's good for your heart is good for your penis. This means regular aerobic exercise. I'm talking about 30 minutes of moderate exercise most days of the week. Walking, swimming, cycling, whatever gets your heart pumping and your blood flowing. The research is clear. Men who exercise regularly maintain better penile health well into their later years. Address your testosterone levels. Get tested. Not just total testosterone, but free testosterone too. If you're low, work with a qualified physician to explore testosterone replacement therapy. This isn't just about libido. Optimal testosterone levels help maintain penile tissue health and can slow or reverse some age-related changes. The pelvic floor matters more than you think. Strong pelvic floor muscles improve blood flow to the penis and can actually help with both size and function. Kegel exercises aren't just for women. Contract your pelvic floor muscles as if you're stopping urination midstream. Hold for 5 seconds, relax for 5 seconds. Work up to 3 sets of 10, 3 times a day. Consider penile rehabilitation. This might sound clinical, but it's based on solid science. Regular use of a vacuum erection device, even if you don't have erectile dysfunction, can help maintain penile health by promoting blood flow and preventing tissue changes. Some urologists recommend this as preventive maintenance for men over 60. Nutrition and supplements. A Mediterranean-style diet rich in antioxidants, omega-3 fatty acids, and nitric oxide-boosting foods can improve vascular health. Foods like watermelon, pomegranate, dark chocolate, and leafy greens are particularly beneficial. Some men benefit from supplements like L-arginine, L-citrulline, or ginseng, but always consult with a healthcare provider first. Quit smoking and limit alcohol. Smoking is absolutely devastating to penile health. It accelerates every negative process I've described. If you smoke, quitting is the single most important thing you can do. Excessive alcohol consumption also impairs testosterone production and blood flow. Maintain regular sexual activity. Whether with a partner or solo, regular erections are crucial for maintaining penile health. If erectile dysfunction is preventing this, address it medically rather than just accepting it. Here's when you should definitely consult a healthcare provider. If you notice sudden changes rather than gradual ones, if you're experiencing pain, if you have significant curvature developing, or if these changes are severely impacting your quality of life or relationship. A urologist can evaluate whether you're a candidate for treatments like testosterone therapy, medications to improve blood flow, or in some cases, more advanced interventions. Don't be embarrassed. They've seen it all, and addressing these issues is literally their job. Look, getting older isn't for the weak, and our bodies change in ways we don't always like. But the difference between men who age well and those who don't often comes down to taking action rather than just accepting decline as inevitable. The bottom line is this. While some penile changes with aging are normal, significant shrinkage isn't something you just have to live with. By addressing your overall health, maintaining good vascular function, optimizing your hormones, and staying sexually active, you can slow, stop, and sometimes even reverse these changes. If this video helped you understand something you've been wondering about, hit that subscribe button. I release new content every week about the health topics that matter to men our age, the stuff nobody else wants to talk about. Your health, your confidence, and your relationships are worth fighting for, no matter what age you are.